word, Congressman Tom Cotton and Senator Ron Johnson. Guys, welcome back to the program.
Well, Sean.
Hi, Sean. Great to be on.
All right, Senator, before we get to the if you like your plan, you can keep your plan act, which you proposed in the Senate. Now the House has their version. I think I've studied the Clintons pretty well. Bill Clinton doesn't do anything without thinking it through. James Carville was talking about the president toking on a crack pipe yesterday. President Clinton saying this today. Seems to me the Clintons have designed these remarks to kind of give a wink and nod to Democrats, get out of this. How do you interpret them?
Well, that may be, but you know, let's face it. I'm just going to show how bipartisan I am. I totally agree with President Clinton when he says that the President Obama ought to honor that promise. And let's face it, Sean. What President Obama did is he basically perpetrated a massive political fraud on America. You know, if that occurred in the private sector, that massive consumer fraud, that would be subject to criminal charges. So I really do believe that former President Clinton is absolutely right. President Obama ought to honor that promise and start working with people like Congressman Cotton and myself to start fixing that damage.
What do you think, Congressman?
I have to agree with Senator Johnson, and I agree with my fellow Arkansan, President Clinton. The Democratic Party should step forward to fix the mess they made with Obamacare, and President Obama should keep his promise. He clearly knew, going back to the summer of 2010, that millions of Americans, tens of thousands of Arkansans, were going to lose their health insurance. And that's what's happening right now among individuals buying individual policies. But I'm starting to hear as well from people at small businesses who are starting to lose their policies as well, or see their premiums double or triple, or see their co-pays go up. We need to take action in the Senate and the House to make this right.
You talk about those 2010 numbers. You're talking about July 10, and that's when they were having an internal debate inside the White House whether or not to tell the American people, to tell everybody watching the truth about the numbers and those that would lose their health care plans. Those estimates, we've had analysts on this program say that number will be as high as 100 million. As you look at their own estimates, what do you conclude?
Well, Sean, first of all, it is absolutely correct that 40 to 67% of individuals will lose their individual policies. But listen, I bought health care in my business for 31 years. The incentives in Obamacare are all for employers to drop the coverage, not pay $15,000 for a family plan, but pay the $2,000 penalty and make their employees eligible for the huge subsidies in the exchanges. So that was the design of Obamacare, to basically, you know, put as many Americans into those government-run exchanges as the first step toward a movement toward a single-payer system.
Yeah, well, Congressman, because the estimates, their own estimates, in July of 2010 was 70% of individuals would lose their plans, 65% of small business owners, they would funnel them into the system, and 45% of even big business. Now, we see the enrollment rate is what, 90% lower than they expected. Don't these low enrollment figures undermine the law's financial stability? Isn't it predicated on huge numbers of people signing up? Does this now render the law unsustainable right now?
I'm afraid, Sean, that it might. The President and his administration has said they need 7 million enrollees by the end of March, and we have reporting now that they have fewer than 50,000 in the first 45 days of the law. This could lead to a kind of death spiral, not just for individuals facing ever higher premiums and deductibles, but also for the federal treasury as the costs go up and up and up as people are in the exchanges who have higher and higher health care costs. So this is just another flawed premise of Obamacare, and why the law from the very beginning was not work. The cancellations we're seeing, the increased prices, those aren't an unintended consequence of Obamacare. Those are very much the intended consequence.
All right, Senator, let's go to the idea. In the House and Senate, they've got, if you like your plan, you can keep your plan act. Politically, I want to ask you this question. It seems to me that we may be at the point Republicans ought to just say, let's scrap this, cut our losses now, and before everybody starts losing their plans, let them at least go back and keep the plans that they have, considering this probably can't work. Will Republicans unite on that platform?
Well, I hope so. I think I have 42 Senate Republicans co-sponsors of my bill. If you like your health plan, you can keep it act.
Any Democrats?
Sean, not yet, but of course Mary Landrieu's kind of got her own version of that, which isn't quite up to prime time, quite honestly. But one thing people have to recognize is Obamacare has already done a lot of structural damage to the insurance market. For example, high-risk pools are extinct. You know, so, for example, that couple with cancer in Wisconsin that is losing their coverage, seeing their premiums double in the exchanges, there's not much we can do about that, but we can try and limit the damage for millions of other Americans, and that's what I believe Democrat senators need to do. Is they need to step up the plate, and we need to try and honor those promises for as many Americans as possible.
I think considering Mary Landrieu and all these red state Senate Democrats have made the same pledge that Obama made, I think they need to be tested on whether or not people should be able to keep their plan, considering that's what they promised. Last question, Congressman. The Democrats, I suspect, may push for delay. I'm not sure if that's a good strategy for the Republicans to allow that to happen, because that sounds like a political strategy to get past the 2014 elections. Would, at that point, would Republicans say, no, we don't believe in delay?
Sean, both Senator Johnson and I, as well as most Republicans in both the House and the Senate, have voted for delay of this law, either in whole or in part in the past, for the very reasons that Senator Johnson just said. Obamacare is doing massive damage to our health care system right now. We have to take whatever action is available to ensure that that damage stops, that the American people get some degree of protection from it. We would love to repeal it. That might be hard to do while the president is still named Barack Obama and the law is named Obamacare. But if we can delay it, or if we can repeal parts of it, or ensure that we get health care plans that are legal today grandfathered, we can provide as much protection to the American people as possible.
All right, guys, good to see you both. Appreciate it. I can't wait to see how the Democrats vote on their promise. If you like your plan, you can keep your plan. This is going to be a fun vote to watch.